Turn on your videos and we can start.
Ma'am, can you start
Caroline
now?
and yeah, you and who is your partner?
Module.
Okay. Okay, you can start.
Good afternoon, ma'am.
Good afternoon.
Okay. The topic the topic of today is about pneumonia. So, definition of pneumonia. Pneumonia is a lung infection that can be range from mild to be severe that you have to go to the hospital. It happens when an infection causes the air sac in your lungs to fill with fluid or foam. It can make it hard for you to breathe in enough oxygen to reach your bloodstream. Then, symptoms of pneumonia. The symptoms of pneumonia are common pneumonia symptoms include pain when you breathe or cough that produce phlegm or mucus, fatigue and loss of appetite, vomiting and diarrhea, shortness of breath. Then, causes of pneumonia. Bacteria, viruses, or fungi can cause pneumonia. Common cause include flu viruses, B. cold viruses, and RBS viruses. The top causes of pneumonia is baby age of 1 or younger. Bacteria cause streptococcus pneumonia and mycoplasma pneumonia. Then pneumonia diagnosis. Blood tests to look for signs of bacterial infection. A chest X-ray to find infection in your lungs and how to far it spread. Pulse oximetry to measure the level of oxygen in your blood. A sputum test to check the fluid in your lungs for the causes of infection. Then pneumonia complication. Pneumonia can have complication including bacteria in which bacteria spread into the blood. These can cause sputum, shock, and organs failure. Trouble breathing, which might mean you need to use a breathing machine while your lungs heal. Fluid build up between the layers of tissues that line your lungs and chest cavity. The fluid can also become infected during abscess with a pocket of fume form inside or around your lungs. How can pneumonia be treated? Pneumonia can be treated. A doctor can tell you which treatment is right for you. If you have bacterial pneumonia, you'll get antibiotics. Make sure you take all the medicines your doctor gives you, even if you start to feel better before you're through with it. If you have a viral pneumonia, antibiotics won't help you to rest, drink a lot of fluid, and take medicines for your fever. If your symptoms are severe or if you have other condition makes you move likely to have complication, your doctor sends you to the hospital with any kind of pneumonia recovery will take time. You're going to need lots of rest. You might need a week of your usual routine and you could still feel tired for a month. That's all, ma'am. Thank you.
Okay, who will be continuing? Asang. Asang, you can continue with the rest portion.
Good afternoon, ma'am. Good afternoon, my friend. My name is Timothy, and today my presentation is about pneumonia. First introduction. all lung infections characterized by collection surface and other fluid in the lung air as aerolic lung air as are structure help in the exchange of oxygen and carbon dioxide collections of pulse and then make breathing difficult. And common symptom of pneumonia, coughing, fever, sweating or disease, shortness of breath that happen while doing normal activity or even while resting, or chest pain that was, that was when you breathing cough, breath of cough, and feeling of tiredness or fatigue, loss of appetite, headache, and other symptoms can vary according to your age and general health. Um, chil- Children under 5 years old may have fast breathing or wheezing. Middle age infant may have appear to have no symptoms, but sometimes they may vomit, lack energy, or have trouble drinking or eating. And older people may have milder symptoms. They can also exhibit confusions or lower than normal body temperature. And causes of pneumonia. Causes of pneumonia. There are several types of infections agents that can cause pneumonia. First, bacterial pneumonia. In fact, the most common causes of bacterial pneumonia is Staphylococcus pneumonia and viral pneumonia. Viral pneumonia, respiratory virus are often the causes of pneumonia. Some example, influenza, rhinovirus, and fungal pneumonia. In fungal pneumonia, fungi come from soil or bird dropping can cause pneumonia. They most often causes pneumonia in people with weakened immune system. For example, histoplasmosis species. And last, treatment. Uh, the treatment depends on the type and severity of the pneumonia. In bacterial pneumonia and bacterial type of pneumonia are usually treated with antibiotics. Viral type of pneumonia are usually treated with rest and plenty of fluid. Antiviral medication can be used in influenza. And fungal types of pneumonia are usually treated with antifungal medication. Thank you. Thank you, ma'am.
Okay. Okay, Caroline, you can ask questions.
Miracle. Miracle. You can hear me? Miracle.
Yes, Carly.
Okay. Let me ask you a question. What are the symptoms of pneumonia?
What are the symptoms of pneumonia?
Yes.
Of fatigue, loss of appetite, and shortness of breath.
Okay, it's correct. Thank you. Then,
Welcome.
Kintio, you are there? Kintio, can you hear me?
Yes, Caroline. Yes.
Okay, let me ask you a question. Okay. What are the causes of pneumonia? Causes of pneumonia.
Flu viruses and cold viruses.
Okay, it's correct. Thank you, Kintio.
Welcome.
Then, Nafisisha. 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 Can you hear me? Nafisisha. Okay. Nafisisha, can you hear me? Nafisha, are you there?
Ask somebody else.
Okay, Srijana. Srijana, can you hear me?
Yes.
Okay, let me ask you a question. Okay, how can pneumonia be diagnosed?
With the blood test and just X-ray.
Mm-mm. Okay. Okay, it's correct. Thank you.
Okay,
And
Asing, ask.
ma'am,
Okay.
Ma'am Kajal. Hello.
Yes, I think.
Kajal. Hello.
Yes, yes.
What are the other symptoms? Symptoms according to your age and general health.
Can you please repeat the question?
What are the other symptoms according age, your age and general health?
Symptoms. Uh, Chest pain when you breathe or cough.
No other symptoms with age.
Don't know.
In first children under 5 years children, they first breathing or wheezing. And infant years, little years, they they have no symptom, but they may vomit, lack of energy, trouble or trouble drinking and eating. And other older people have middle symptom and exhibit confusions or lower than normal body temperature. Uh, Sarjarika, hello, Sarjarika.
Yes. Hello.
Hello, hello,
Hello.
Sarjarika. Do you hear me?
Yes. Yes. Yes.
Oh, uh, in bacterial type of pneumonia, what are the treatment?
Treatment. Sorry, I think I don't know.
They are usually treated with antibiotics. Last question. Kim, do you hear me? Hello, Kim Teo.
Is it done, Asang?
Yes, ma'am.
Then why didn't you say? I was waiting.
Ma'am, last question.
Hmm?
मैम एक्चुअली लास्ट क्वेश्चन नहीं पूछा था ना तो किंतु उसका वो जो रिप्लाई नहीं किया था
होगा ना?
हाँ थैंक यू मैम
ठीक है होगा. Your chart paper is really good, okay? Asang, you have put lots of efforts. I can see in that. Whereas Caroline's chart is okay. Because even Caroline knows that she have not put that much effort by seeing Aseng's chart. By yourself also you can distinguish, right? So nothing to feel good or bad, but next time try to make it more better and try to present it more well. Okay? Okay then. Anybody else have the seminar? Any others today? I guess no one, na?
Yes, ma'am. Me.
You? Okay. Join the meeting again then. Because the meeting, the time might end. So join again. Join the class again, all of you.
Okay, ma'am.